Maybe you want to start right after that. Okay. Yeah, so welcome, friends, to the food security, food justice presentation hosted by Lake Erie Yearly Meeting Peace and Justice Interest Group and North Columbus Friends Meeting Peace and Social Action Committee. We're co-hosting this event. In this, as the flyer that went out indicated, the speakers will provide an informational overview of the larger issues around food sovereignty, food security, food justice, and so on, before diving into concrete strategies for advocacy and action, including community-based as well as broad-based movements seeking to ameliorate food insecurity and/or affect systemic change. Before I introduce the speakers, I would like to, in our Quaker tradition, just center for a couple of minutes in silence. If you wouldn't mind muting yourselves, that would be appreciated. Thank you, friends. Thank you for joining us. Our presenters, and by the way, I'm Rick Adams, North Columbus Friends Meeting. The presenters today are all actively involved in food justice and food advocacy. Ilana Warner is a member of North Columbus Friends Meeting as well. And she is, let me get our speaker bios here. Ilana serves as an Operations Database Associate at Project Bread, a hunger nonprofit in Boston. She received her bachelor's in urban and regional studies with a minor in nonprofit administration at Cleveland State University. She focused her studies in food security nonprofits by learning policy, fundraising, and grant writing. Her passion is to advocate, educate, and generate funding to end hunger, and which led her to reach out to Peace and Social Action Committee to highlight this important issue for us, and hence our work with LEYM, Peace and Justice Interest Group. Tim White, if you don't mind waving when I introduce, yeah, there's Tim. Tim has served in the position of Advocacy Manager for Mid-Ohio Food Collective since February 2018. Tim utilizes his years of public affairs experience to assist Ohio's largest food relief agency to navigate traditional issues such as federal and state anti-hunger programs funding, while helping shape a new pathway to tie together nutritional food assistance with the other social determinants into health-based outcomes, helping our neighbors successfully find their path to self-sustainment. And Hallie Carrine, there you are. Hey, Hallie. Serves as Grassroots Government Relations Specialist for the Mid-Ohio Food Collective, and she brings community development and capacity building experience to the collective after serving as an AmeriCorps Vista, for them as well. Her knowledge and experience focuses on helping agency partners expand, adapt, and advocate to best serve their neighborhood's needs. So there's your introductions to our speakers. And Ilana, I would just hand it over to you to get us started. Thank you for being here.
Thank you, guys. I'm really excited that everyone's here to attend. I'm going to start off this presentation with a video of a parable by Dr. Rashish Mencherda, and I'm going to share my screen. So one moment for that.
There are three friends who come to a river, and it's a beautiful day, but that scene is pierced by the cries of people in the water in the river, crying out for help. They need a rescue. The three friends do what all of us do, especially those of us in healthcare. They jump right in to save those people, adults, children, the elderly. At first, the first friend, the strongest swimmer, says, I'm going to focus on those who are about to drown, just at the edge of the waterfall. Everybody applauds that decision. Of course, it makes total sense to rescue those about to drown. and everybody doubles up and says, let's rescue. People along the sides of the riverbank say that let's invest more resources, give that rescuer what he or she needs. But over time, it becomes clear that that's insufficient. People slip through the grasp of the rescuer. Clearly, something else is required. The second friend, actually, along there says, you know what, to make this easier, to make our success rate go up, let's coordinate the branches along the banks of the river here and create a raft so we can usher more people to safety, prevent people from going further downstream in need of rescue. We all applaud that. The success rate goes up, fewer people in need of downstream rescue, more people on the raft getting ushered to the riverbank. And yet, in the course of that work, the first friend and the second friend, the downstream rescuer, the raft builder, realize something is happening that they can't fully articulate, but they see it every day. The people keep coming. The success rate, while better, still isn't as good as they would want. People slip through. They start getting tired. They start getting a little jaded, perhaps. They start saying things like, to the people in the water, why don't you know how to swim? They start considering other rivers to jump out into, leaving maybe the purpose of rescuing. They start getting tired. But like a lot of us, they remain doubly committed to the work, and they remain heroically, nobly committed to rescuing, despite this strange phenomenon. Finally, they realize that they came with a third friend, and they don't see that third friend. They finally spot her. She's in the water. She's rescuing people as she's going, but she's swimming away from them, much further upstream. And they shout to her, where are you going? There are people here to save. They're in dismay. They're wondering why their third friend, a vital part of their team, is now leaving them. Turns out she's not leaving them. She's actually in the water again, helping people as she's going, and she shouts back to them, I'm going to find out who or what is throwing these people in the water.
So that's one of my favorite parables about public health. It's been shared many times by many public health scholars, by Dr. Mincherda and Irvin Zola. These parables are talking about public health and how at a certain point people get swept away with the issues in public health. And in this instance, I would like to frame it as food insecurity in America. I believe that this parable is able to be a frame in which Quakers as well as active community members can alleviate food insecurity in our communities. In the story, there's three friends, like we heard, and they're all working really hard to save individuals. And I wanted to take these characters and sort of give examples of what those three interventions could be in the food insecurity world. So the first friend who's jumping in, I'm getting a little lost, sorry guys. So in the story, we have three friends who are working all hard to save individuals who are getting swept away in the river. These individuals spoken about are akin to many community members who are struggling with food insecurity and people who have a hard time having enough food to live healthy and active lives. As Quakers, we're interested in combating food insecurity. I hope that we can all work like these three friends who came to the river and saw this problem and started to address these issues. Hopefully after this event you have a few more tools in your toolkit to be like the person who goes upstream. The first friend goes in and tries to save people who are drowning. These are like the amazing people who volunteer at soup kitchens and work hard to give food out to the community members that are in need. The second are the friends who start the second friend who is building a raft is individuals who are at local meetings setting up those food drives that we all really appreciate and know, and are those active members who work to get our food banks the necessary food. And finally, the third friend, which I personally aspire to be, is the one who goes up the river, which is looking at the root causes of food insecurity. Everyone who is here today actively wants to learn about this, and I'm so glad that you're here today. And the third friend, what we can do is start learning and understanding nutrition legislation, as well as addressing the root causes like affordable housing and the gender wage gap. I hope that the story has helped, and that the next steps that Hallie and Tim White are about to outlay will help you. And yeah, I hope that the parable was appreciated. Handing it off to Tim White and Hallie. They work every day to address the issues upstream, midstream, and downstream. Thanks, guys.
Thank you, Ilana. And first, thank you all for having us in here today on behalf of myself and Hallie. We appreciate the opportunity. Any chance we can share the work and the need, we are delighted to, and especially to Ilana and Rick for working with us, getting us ready, being the ones to get us here today. So thank you all for that. And I am going to hand it over to Hallie. She's going to be the operator for the PowerPoint and kick us off.
All righty. Again, thank you as well for having us today. I'm going to share my screen and get this presentation going for you guys. All right. Okay. So, first, we always try to introduce these presentations by kind of addressing the kind of elephant in the room, is that oftentimes there's this huge misnomer that nonprofits and charitable organizations can't lobby for themselves and can participate in advocacy and lobbying work, which is not necessarily true. For charitable organizations, lobbying is a great way to utilize this as an educational tool to educate communities, educate local officials on the issues that you are working towards day to day. And so lobbying often gets this negative connotation that it's more candidate-centric, where we're trying to really focus on kind of convincing a candidate, hey, please vote for this bill that is really impacting us, which is obviously what we do want, but sometimes there's that negative kind of connotation with it. And so a lot of times charitable organizations are really fortunate that what they're advocating for is more issue-based. And so as we go forward, we'll kind of go into different ways that charitable organizations can engage in advocacy efforts at various levels in our communities. So what is advocacy? And so advocacy is a really great and effective way for nonprofits to be able to kind of steer public debate on support different important social issues. So for us here at the Middle Ohio Food Collective, it's food insecurity, hunger, and all the different factors that can impact that, whether it's housing or it's lack of transportation. And we'll kind of go over some of those and how those impact food insecurity a couple slides later. So the term advocacy encompasses a broad different range of activities that one can do in that sphere, whether it's research, it's public education, it's the actual lobbying of going and meeting with your local officials, or it's also voter education too. So providing information to your community members on issues that they should be voting for and supporting. At the end of the day, advocacy is a great way that nonprofits can bring about the understanding of these issues and help to bring about systemic and lasting changes. And so my role here at the Middle Ohio Food Collective is more grassroots centric. So grassroots advocacy is something I really do love to talk about. It's more citizen involvement. And so a lot of times it's a great way for us to be able to connect with individuals who are personally impacted by an issue and communities that are personally at the heart of whatever an organization's mission is. And so what grassroots advocacy does is try to plant seeds of concern and growing awareness within the community and kind of build that natural awareness and activity in that issue organically. And so at a local level, it's really about finding strength in numbers and kind of harnessing that to be able to influence public opinion and then therefore government action. And so, as we mentioned before, advocacy can take place in a variety of ways, both at the local, state, and federal level. So the local level, that could be engaging with your city council, your school board, the mayor's office, your local business leaders. So a lot of times that can be in coordination with chambers of commerce. And then also local organizations. So your county organizations, whether it's your county job and family services, some senior services, veterans programs, organizations for developmental disabilities, et cetera. At the state level, you're looking at your more interaction with your state legislative body. So your state representatives, your state senators, the governor's office, and then the attorney general. There's also a state chamber of commerce that interacts with states that go abroad farther than their local communities. And then we also have state level agencies. So this is where you may start to look to connect with organizations like Medicaid, the Ohio Department of Agriculture, or Michigan, Pennsylvania, wherever it may be that you are, or even the Ohio Department of Education is also a big one too that we'll interact with a lot. And then federal, that's interacting with Congress, and also federal agencies as well. So when you look at these regulatory bodies that impact us on a federal level, we're looking at the USDA, for instance, where we're looking at specific funding for things like the Farm Bill and SNAP, which is the Supplemental Nutrition Assistance Program. So today, as Ilana was talking before, we're going to kind of take a little bit of a public health lens of how we work in today's presentation. And so what I'm going to talk a little bit about today is social determinants of health, which food insecurity is considered one of those. So for those who are not familiar, social determinants of health are conditions within our environment where they impact the way where we are born, live, learn, work, play, worship, our age, whatever it may be, is impacted in our health outcomes. So what that basically can translate to is how you exist in society and where you are located can directly affect how your health outcomes are perceived. So for instance, let's say that I was someone who lived in a neighborhood where there was a right by the water, and there was a factory, and there was runoff going into the water. So that is my drinking water. And so whatever is in the runoff is directly affecting my drinking water. If I'm having adverse reactions to something in my drinking water, because of my environment that I live in, it's directly affecting my health. Same thing with food insecurity. Let's say I live in a neighborhood that doesn't have a grocery store. And so therefore I have a lack of transportation. That directly affects my health outcome of being able to access healthy food or even just access a grocery store in general. And so there are a bunch of other things, as the list says right on this slide, of different examples of social determinants of health. Education, your ability to access certain job opportunities, polluted air and water, your language and literacy is also can be considered a social determinant of health. And oftentimes, as we can see, a lot of these will coexist. So if you are someone who's facing food insecurity, oftentimes there's another coexisting social determinant of health that is impacting that. So to address this, the Mid-Ohio Food Collective has done a variety of things to kind of address the impact of social determinants of health on food insecurity and hunger. And we'll kind of go into this in these next coming slides. We saw in the wake of COVID-19 that there was a lot of things that were impacting our customers and their inability to either access food from us or our agency partners. And so from that, we were able to extend our hours to up to 40 hours a week, realizing that not only were people not comfortable with going out of the house on busier times of day, maybe, but also the fact that we realized that individuals could not come in our normal 9 to 3 hours. So sometimes people, have to be able to leave before they go to work or before they drop off the kids, or sometimes after work. And so giving that variety of hours as well. And we're also open on Saturdays, which is nice. The next one would be our pharmacy program. And so our pharmacy program is one of our assets of the Mid-Ohio Food Collective. It's our way of connecting with primary care doctors to essentially give a prescription to our customers to be able to get fresh produce via a prescription. And so through this, we can impact things like obesity, high A1C levels, high blood pressure, with better health outcomes of consuming more fresh foods. Our healthy meals that are prepped by our Ohio Kitchen. We do have an on-site kitchen at the Mid-Ohio Food Collective. With these meals, we prep ready-to-go meals that we either give to our school partners, and we have also given some to our veteran services partners as well. And then these last two, our Fresh Track system is a system that was developed here at the Mid-Ohio Food Collective. It's a system where you can go in and put your zip code to locate some of our agency partners within your area, shows hours of operation, how the distance that it is from your address, so that you can know in close proximity where are places that you can receive food. And then our last one is the Mid-Ohio Farm, which is another one of our assets. The Mid-Ohio Farm is located in the Hilltop neighborhood of Columbus, and is an opportunity for us to be able to educate community members on more sustainable farming practices, as well as urban farming practices as well. So just going back into this kind of social determinants of health and kind of the impact of COVID on food insecurity. So a lot of research was able to come about with the impact of food insecurity on COVID-19. Food insecurity actually increases the risk of exposure to COVID-19, and poor health outcomes increases susceptibility to COVID. And we also were to see that poverty increases the risk of to COVID-19 exposure and inadequate care. And so these two figures on the left or on the right show kind of how the way that COVID-19, food insecurity, poverty, and health, they're all kind of all work in a loop. It's a giant feedback loop where if you are impacted by one, you're most likely to be impacted by another. And so we saw issues of hunger, poverty, and poor health outcomes within the US prior to COVID. After the onslaught of COVID-19, we saw a lot of those numbers and impact triple, if not more, post COVID-19, or still now technically. We've seen triple the rates of national hunger. More households have been experiencing food insecurity and difficulty paying their bills and other expenses. And then a lot of times we have found that comorbidities have existed within COVID-19, correlating a lot of times county level poverty and low income inequality as issues for poor access to care for COVID-19. So according to Feeding America, and I hope that this isn't too small, but according to Feeding America, more than 17 million people in the country could and have become food insecure because of the pandemic, bringing to the total to more than 54 million people in the country, including 18 million children that have been impacted by food insecurity because of the impact of COVID-19. And so this chart on the right, the different colors just shows the impact of either less food insecure or more food insecure. And you can see that our communities of concern today, so Ohio, Pennsylvania, and Michigan, have some of the mid to highest levels of food insecurity within COVID and post-COVID. And these are kind of just percentages out of 50 of how impacted they are by food insecurity.
Hallie, could you just read the percentages for Ohio, Pennsylvania, and Michigan? Thanks.
Of course, absolutely. So the Michigan percentage out of 50 is 24.2. Ohio is 25.1. and Pennsylvania is 26.1. So showcasing that more than half of the residents in Ohio and Michigan and Pennsylvania are impacted by food insecurity. And then these are just some stats that we were able to kind of get together for you guys. And we're going to send all these slides out for you guys as well as a point of reference. So these are the state of hunger, poverty in this specific region. We're seeing that in Ohio, Pennsylvania, and Michigan, roughly almost 500,000 of residents of workers live in households that have participated in food assistance programs, whether it is SNAP or some other variation of a food insecurity assisting program. Whoop, as I'm going up. Oh no. There we go. But over 60% of those individuals are SNAP participants that have families with children. More than 10% across the board are households that are food insecure and can't afford a nutritionally adequate diet. Also across the board, more than 12% live below the poverty line, which for these stats, it was 200% below the poverty line. The other percentages below, again, more than 15% across the board are children living in poverty amongst these three states, as well as more than 8% of elderly live in poverty amongst these three states. So unfortunately, and when this is a kind of a phrase that goes around our organization, is that we want to be able to work so that we can go out of business. But unfortunately, with COVID and the various social determinants in health and other aspects of society that makes it a little bit difficult, we're still very much in business of trying to get food on the tables of hungry Ohioans. And from there, I'll let it go to Tim.
Thank you, Hallie. Appreciate it. And just a couple points to build off of what Hallie said, because she did cover it well. But absolutely, her last point, our mission is to end hunger, and we often talk about, you know, one day padlocking our front doors because our services will no longer be needed. And we recognize it's probably not going to happen in our lifetimes, but it's still what we're going to work toward. That it is not just feeding the line, providing food, but doing what we can to try to lift up people so that they are self-sufficient. And just kind of when we talk about grassroots and the impact, you know, it's interesting. There are times people will have impact and they may not even realize that they are doing so, or the level of impact. And a couple of examples from our experience off of that: a number of years ago, our board of directors was meeting and talking about the strategic plan and what were we doing. And one of the board members spoke up and said, "We're not meeting our mission. We're not meeting everything we talk about. We are feeding people. What are we doing to try to end hunger?" And it really was a watershed moment, because that is what got us into working on the social determinants, tying into some of the other factors that go into it. So just that one comment off of a conversation changed the direction of our services, our organization, our focuses, because somebody pointed out we were talking about it, but we weren't doing it. And the other thing, now Hallie mentioned we have extended hours. Well, what that came off of, our CEO was in the on-site pantry one day, was talking to one of our customers, and the customer told him he could not afford to come to the pantry. Now think about that. Free food, and the individual saying that he could not afford it. Our CEO asked him, "What do you mean? You know, it's free food, you can come get it." And the guy talked, "I work through the day. I have children." He listed all of the impediments to get to our pantry when we were open to get the food that his family needed. And that was another light bulb moment, that it was, we have to meet the customer where they are. And that was have hours where the pantry is open after traditional business hours on the weekend, to ensure that people do have the access to it and it doesn't cost them to come to us. And so just, you know, starting out as we're talking today on action and other items, you know, keep in mind that you can always have an impact, and you never know where it is going to happen, because those are ones that just through conversations fomented considerable change in our operations. So with that, I'm going to get into the state process primer. I will be focusing a little bit more on the actual how-tos, what-tos, and how the process works on the advocacy front. And I did drop into chat some links because we had links for Ohio in here, but I also wanted to provide for the Michigan legislature, the Pennsylvania legislature, as well as for the food bank associations, which are the associations of food banks, cover each of the states. And that is where a lot of the activity takes place through those respective links. So you get into state process, and bill process is the same in all three states. That you have bicameral legislatures, which means you have the House, you have the Senate. They may be called different things. You have the governor's office, and the bills, the process has to go through that from the committee to the floor to the other chamber to the governor. And through that process, you have the potential for the governor to veto, non-concurrence, other process swerves, the whole amendment process. And so that's where it can really take a lot of time to get a bill through. State budget process, a lot of what we do is on the advocacy side is based off of funding, because our programs, we are heavily involved with the SNAP program that Hallie mentioned earlier. 9 out of 10 meals on hunger relief go through the SNAP process. It is the largest hunger relief program in the US. The other 10% is what we do. And when you stop and think that we at Mid-Ohio Food Collective are now pushing over 6 million pounds of food a month to our hungry neighbors, multiply that out by the year, and yet we're still only picking up a small percentage of the entire anti-hunger relief efforts out there. That gives you an idea of some of the programs, SNAP, the school feeding programs, a lot of the government programs, and how important they are and the vital role that they play in all of the efforts on this. State budget for Ohio, it does go every 2 years, and I need to double check my notes real quick because Michigan and Pennsylvania both have single budget years. So what that means, Michigan and Pennsylvania, there will be ongoing budget deliberations, enactment of the budget every year. And for Ohio, we run from July to the end of June for our budget year. And Michigan actually follows the federal budget year of October 1st through September, and Pennsylvania is with Ohio and going from July to June. And it's important to know when the budget year does go, because that will dictate when budget deliberations and other actions take place. And again, it doesn't matter what state, the funding of these programs, making sure we are able to offer our relief efforts, that is what's really paramount. And we will get into other issues such as regulation related to Medicaid, SNAP, and the other programs like that. But a lot of focus for food banks is on that funding, which comes from the federal government down to the state. And Hallie, if you want to go ahead, next slide. In the federal process, it's very similar from the committee to the chamber to the president can go. The big difference between federal government and the majority of states is most states you will see a bill goes to a single committee. For some reason, the federal government thinks it is a good process to send a single bill to multiple committees for hearings, which adds additional layers onto getting stuff passed. And it can really slow down the process. But otherwise, it's pretty much the same. It goes through the legislature. It does go to the president then for signature, and you have the possibility there for veto and other stuff. And the budget process, budget October 1st through September. The current operating budget for the federal government is probably going to be finalized in the coming week. We have been operating as a country on continuing resolutions and extension of the current budget year, and that has become the norm. And that's, bluntly, I will throw in my opinion, say that's not good policy, but it is the reality now that the budget deliberations have increasingly become bogged down. So we are just now finalizing the budget that's going to end September 30th. And as soon as that's done, it's going to start up for the next operating budget and hopefully be able to get that into place without extensions. But I would not be surprised if that happens again. Within the budget process, for us in particular, the Farm Bill is one of the biggest pieces of legislation. What you have on the federal government, individual pieces of legislation will lay out the parameters for programs, and the Farm Bill lays out for agriculture and some of the other areas that we deal with. So SNAP, the nutrition programs go through the U.S. Department of Agriculture. Therefore, they are contained in the Farm Bill, and the actual appropriations will be put into the budget bill. So you have two different areas that this Farm Bill says, okay, here's what's going to be the size of the program, what it does, and then the budget actually does the appropriation for it. And on the federal budget process, there are 12 major funding bills that cover defense spending, agriculture, healthcare, and other areas. So it is broken into 12 major bills that set the government operations, the parameters, and then under those you will have individual line items and breakouts for each. So it really is an interesting process on the federal level, and the fact that it keeps getting delayed every year makes it a little more difficult, but we're working within that framework. So Hallie, if you want to hit the next slide. Thank you. Yeah. So on the federal level, laid out, here's the process. The budget is very important to it. And what are going to be some of the issues that are coming up? It's been COVID-19 relief. The federal budget is always going forward. The Child Nutrition Act lays out a lot of the programs, the parameters, and the funding for a lot of feeding programs specific to children. It is supposed to be reenacted at least every 5 years, and it's been 10 years now and counting. So we're trying to get the updated, because what that means is a lot of the children-focused nutritional programs are operating on guidance and regulations that are a decade old. And a lot has changed in the last decade, so you can imagine what the impact of that has been. Farm Bill is enacted every 5 years. It's up this year, and so that's going to be a major focus for us. Tfap is the Emergency Feeding Assistance Program, and that's where we get a lot of our funding, is through that. Tfap through the U.S. Department of Agriculture. And then not only is legislative, but once the bills lay out the parameters, then it is up to the individual federal agencies to implement the underlying regulations for it. And so we work closely with the U.S. Department of Agriculture and others in putting the meat into a lot of these programs. You'll see a legislative bill is sort of the skeleton for the programs, and then it is built around that to say this is actually how it is going to operate. And one of the big things that is coming up now is the end of the pandemic response. The federal public health emergency is what allowed a lot of the regulatory changes that allowed us to simplify our operations, that got us additional money to respond. And really, without those regulatory waivers, we're not sure if we would have been able to have given the response that we had. Sometime in June or July of this year, it is expected the public health emergency is going to expire. And when that expires, all of those underlying waivers will also. For us, just in our particular field, there were, I believe it was 68 individual waivers that impacted us. Now you take that across in the Department of Education and Health and Human Services and elsewhere. And I mean, there were hundreds of regulatory waivers that allowed response to the pandemic that are all going to expire. And that's going to be the one big issue, is how do we return to normal, to pre-pandemic regulations, oversight, operations, and make sure that we don't lose customers along the way. Because as Medicaid returns and the individuals have to be certified and recertified, it's almost like a giant funnel that these people are in that funnel. All of a sudden it's taken away, and you're going to have a lot of folks having to comply with the existing regulations all at once. And the concern is it's going to overwhelm the system and people are going to fall through the cracks. And that is absolutely what we try to avoid, is having people not get the food relief, not get the health care assistance that they need because they fell through the crack or they ran into, for Medicaid certification, recertification, saying that they are eligible. If they cannot get through to the respective department, to their caseworker, to finalize their eligibility, then they're cut off. And if a department is understaffed and people literally cannot get through the phone lines or do it online, they're going to lose their eligibility through no fault of their own. And that's the biggest concern we have off of this. And that ties down into the social determinants of health that we know with the expansion of Medicaid, the number of people who became eligible for Medicaid through some of these waivers, as well as prior expansion, that if they fall off of those rolls, they're going to end up in our lines, and we're going to see an increase in food insecurity. And that's where the social determinants really tie in: housing, employment. A lot of people lost jobs, fell behind. Can they find stable employment again? Because if they can do that, then most likely they are going to be self-sufficient. If not, then they're going to be relying on Medicaid, on our services and elsewhere. And again, concerns in that system. So, Hallie, if you want to hit the next slide. Thank you. So that's an overview of the issues. And if there are questions, comments off of those, please feel free to speak up. I generally want to have done presentations. I do like to keep them informal and have it be more so discussion, so we can get deeper into some of those issues if we want to. But if we've identified the issues, then the next thing is, okay, what can we do? How do we do it? I put in there the link to the Ohio legislature. Again, in the chat section, you have the link to the Michigan and Pennsylvania legislatures as well. Email has become the primary contact with public officials. It used to be phones. Pretty much now, if you want to set up an appointment, communicate, they prefer email because it's a much more efficient system. So that is just something to keep in mind. Go to their individual websites, find their email, and those links will take you there, and that is a way to get in. One of the things I do emphasize, and I think it is very important, is be polite, professional, succinct. I tell individuals, this is no different than a business meeting. You are not going to try to make headway with the business client by being belligerent. But the reality is, this is a personal issue for many people. It's an emotional issue, and it is very difficult to lose some of that business savvy on how to get your message heard. And so I emphasize to folks, please treat it as a business opportunity, polite, professional, lay out your argument, be succinct in it, recognize there are time constraints, but very much I think the polite is the thing, because having worked in the Ohio State Legislature and having served on the lobbying side, I can tell you I've seen too many times where, because it was an emotional issue, people lost control and probably lost traction on their issue. And the other thing, on the food insecurity, as well as when you get into, whether it's Medicaid or other areas, always end with a action request. So if you know the local food bank, or if you are talking to a legislator and you're volunteering at a local food pantry, offer to help set that legislator to go and see firsthand at that food pantry. If you're involved, working with a federally qualified health center or elsewhere, get that official on site there. Make sure that they see firsthand what you're talking about and the impact that their decisions have into the community, to see and hear firsthand. I can tell you, I've stood with multiple legislators outside of our facility as we talked about the lines at our on-site pantry and the impact that visual had on them to see that many people lined up, wrapped around our parking lot back onto the street. That visual image of seeing the people in need, the impact that has is immeasurable. And so getting people onto the site of whatever services, if you have connections with whatever, that is a very effective way. Next slide, Hallie. Thanks. So you've made contact, you've had the issue, they ask, always make sure name, position, organization, why you're contacting them, what the request is. For us, it's an increased anti-hunger funding. Go in with a specific ask if there is one, so that they can take it back and hopefully take action on it. And that includes on the why. And share your experience so that folks understand why it is so important to you. Why is this important to you? And so the thing you can do is talk about, what have you seen in your community? Do you volunteer at a food pantry? Do you volunteer at a health clinic? Have you seen increased need? With the school feeding program, are you seeing increase in children who are hungry in your community? Tie it back to what your experience is and how you have seen that, what you've done, and tie that into the specific ask. Increase funding for food pantries, for food banks, increase funding for school feeding programs, increase support. It may not just be funding. There may be some regulatory or other legislation related to healthcare that can help the healthcare providers and tie together with others. One of the things we are trying to do is change the reimbursement system so that medical reimbursement, healthcare reimbursement accounts for hunger relief, so that the food we are doing, because we can provide healthy food and we've shown that it has positive outcome on people's health. So how do we tie that so that we can cover the cost of what we're doing? And so it may get into reimbursement, it may get into some other areas, but have that specific ask and tie it in and give them contact information for follow-up. So Hallie, if you want to hit on to the next slide, thank you. That's going to bring us into some of the discussion on this. And I do have some notes on specific ask, but first I'm just going to open it up because Hallie and I have been doing the talking here, and we would love to hear questions, discussion, any comments that you have. So what are ways that you've participated in advocacy efforts in the past? And think about, ways that we can, or maybe the local food bank, local food pantry, how some of your local assets can also assist. So any comments or anybody want to share on their advocacy efforts? I should have warned you that, yes, we do try to get participation.
I don't think there's many of us that are very hesitant to participate. So I think that's fine.
Thank you. It's good.
Even though we're not all guys here, when people say, hi, guys.
Noted.
I think I see Phil's hand up. Phil, do you want to speak on your advocacy?
Well, I have a different question.
Yeah.
6 years ago, a minister from the African Methodist Episcopal Church and I started a food pantry. We have since developed warm meals, and then we give them boxes of food. We also have a closed pantry, and we started a garden with 100% of the harvest going to the food pantry so they get fresh foods. Now, as far as the game plan, that sounds good. I have members of the United Methodist, the First Baptist, and AME joining us, volunteering. When it comes to the Quakers, they talk a good story, but I never see them. It's like one lady did come that was a Quaker and said, oh, I can smell smoke off these homeless people. I can't work here. So I mean, you've discussed some really great advocacy and really great things to do. But when you can't motivate the people, just one thing on advocacy, and then I'll leave it open for some questions or answers. Last year, I realized that the poor didn't have a dental program. So I personally called the Dentist Association of Washtenaw County and some county commissioners I knew. And now we have for every poor person a dental program. It was like a 2-hour project. It wasn't very hard to get this put together. Yet I tried to approach Quakers and I get zero support. What do I do?
I will,
So,
yep, go ahead, Ilana. Yep.
of like your local Quaker meeting, I'm not sure what their specific role is in it, but for me, as a Quaker who really is active in working to end hunger, is a lot of what I do is I've been trying to work actively and talk with members. So I don't know that particular situation, but I think every Quaker community deals with it in a different way. And I know that there are other churches that might do it in a different way, but I feel like having these discussions and starting to call representatives, it's not like I don't know the specific instance, but there are ways that, like you talked about a specific individual, and everyone works to deal with creating a solution in a different way. So I don't have that specific answer for you, but I would say that you would need to reach out to and have a discussion with the meeting to see what they're doing, because they might be doing more than you think. I don't know. That's a hard question.
I'll tell you, it is a difficult question, and I'll tell you, it's interesting for us because we are our name recognition as a nonprofit in Central Ohio is one of the highest. And pre-pandemic, our volunteer recruitment pretty much worked on its own. It was to a point that we did not necessarily have to go out to pull people back into the community. Well, with the economic shutdown, we lost about 80% of our volunteers. We went from over 13,000 a year to the pandemic, I think, is around 4,000. And as you lose people during a period like that, then you've got to bring them back. And so for us, we have been focusing on relearning recruitment. And one of the things on that, we rely on emotional appeal that, hey, this is your opportunity to come out and help your neighbors and do good work. But we also are trying, we're finding we need to do other ways with it. Fortunately, we have meeting space and some other things. So what we tell people, hey, you can bring your company out here, do a retreat, a team building, and part of that team building is doing a volunteer shift in the agency pantry. And it's a way for them to work together. So we are looking at ways to rebolster our volunteer system. And something you may want to look at is, whether it's a food bank, pantry, or somewhere, for one of your discussions is bring in somebody to talk about volunteer ideas and, what are they doing? What are the trends on that? Because I know that is something a lot of groups that it is across the board. Volunteerism has been dropping in general. I can tell you generally that if you look at demographics, especially by age, folks are grappling with how to engage younger generations because there is a different philosophy to that. They are also looking how to engage, whether it's across religious, demographic, social, how to engage different groups. And it is something that is universal. And a lot of it is finding the value to the volunteers. What do they get back from it?
I wondered if you could say a little bit about the different ways that people are are addressing food insecurity in their communities. Your operation sounds like it's pretty extensive, but there's like Meals on Wheels, and there's community gardens. And what are some of the different ways that people are taking this on that you might spark ideas for us?
Yep. And Sue, did you want to add to that, or?
Hi, this is Sue. I'm at Red Cedar Friends meeting in Lansing, Michigan. And one of the things we did, especially I think motivated by racial justice issues, is we started a tiny pantry, which is a movement around town here. Lots of churches may or may not have heard of it. It's a movement in the US and other states and cities too, but it's simply, we know we have homeless population. We know that homeless population comes through our neighborhood, for our meeting house neighborhood. So a big wooden box on a post out in front of the meeting house. Keep it organized. We started October of 2020 when we knew that hunger rates were going way up. It's stocked every day, and you can, do a search for tiny pantries and find out, everything you would need to know about that. I went to our Greater Lansing Food Bank to volunteer and to ask how could we get donations from the food bank to help supplement into our tiny pantry, and the answer was no. We're part of Feeding America, and Feeding America does not support the tiny pantries. I didn't get exactly why, other than the answer being, well, it has to do with health department regulations. So racial issues, and one of the things that really piqued us, and we did our local Peace Education Center once a year has an alternative holiday sale. So we decided to have a Red Cedar Friends meeting table there to raise money for the pantry, as well as to educate people about hunger. And August of 2020, National Geographic magazine came out with a big spread on hunger. And their statistics, 1 in 4 Native American households, and these are statistics from 2019, so even before COVID. 1 in 5 Black families, 1 in 6 Hispanic, Latino, and 1 in 12 white families with food insecure households. All people together, 1 in 9. So those statistics really drove home the point that it's a racial justice issue also. The pantry is, of course, no questions asked. So all of us who contribute to it, as well as the neighborhood people that contribute to it, we have some personal growth to go through and challenges about no questions asked. It doesn't matter who, it doesn't matter what kind of car they're driving when they drive up to get some things out of the pantry. It's no questions asked. I'm also wondering, this is the time of year when we're turning into Friends Committee on National Legislation, what our meetings want them to focus on. So I wonder, in the listing that I've seen, hunger is not one of the issues, but I wonder if other meetings might have some information about that.
I saw Camilla had her hand up earlier. I think I jumped the queue a little bit there.
Well, thank you, Sue, because you raised some of my points. That was great. I have 2 questions, and I don't know, Tim and Hallie, if these are questions that you can help us with. My first question is, I deal with a population of, or I am blessed with a population of folks that have jobs but don't have enough money to get, they don't qualify for Medicaid, but they don't have enough money for food at the end of the month. And prior to the pandemic, I was very, it was a real struggle to try to make ends meet and to help people. And they had a little bit of a break during the pandemic with the added money from the government. I'm really quite terrified as to what happens to them now. And the thing about it is these are folks that are working several jobs. You know, it's not like they have lots of time to go find aid if there is aid available. And I really don't, I'm sort of at a point where I feel alone and not knowing where to send them and how to get help. That's my first question. And my second question is, we've had mega gardens the last 2 years, and we're finding that this is not really a question, but we're finding that a lot of people that we can give the produce to, our meeting has a month, 3 monthly meals, and then we also have grocery bags, and we also have backpacks that we send home with the kids. And so we found that when I was trying to give away all this produce, that folks don't necessarily know what to do with it anymore. Is that something that you guys find? Okay. And so do you guys hand out, do you hand out recipes? Is that what you do? Is that how? Okay.
So I can definitely speak more on the second part. One of the issues that I was helping to tackle within my AmeriCorps Vista service, I was in our agency services department that are directly connected with our agency partners. And so that was kind of a lot of the feedback that we were getting from our agencies. The shift within the past few years is to focus more on fresh produce and fresh product in general, and kind of destigmatizing what getting assistance from a food bank and a food pantry look like. And so Feeding America has a great resource bank of tons of recipes of a lot of items that are most commonly found in food bank distributions. We were finding the best thing also is we get a lot of feedback from the community. So let's say there happened to be a surplus of watermelon radishes. Not everybody knows what to do with the watermelon radish. So whether a recipe was given out with that specific produce item, or a video like a YouTube link was shared on a specific recipe, that's been helpful too. Being as large as we are able to assess what communities don't necessarily like the product that they receive. So if an agency partner, for instance, in this neighborhood gets a whole bunch of spaghetti squash and don't know what to do with it, then we know, okay, maybe we'll deter that agency from ordering that product again, and therefore suggest a different produce item for them. Of course, the items that we get into our warehouse changes from week to week, day to day. But at the same time, it kind of allows us to kind of assess how to address the idea of not everybody is familiar with the same type of produce all the time. So that's the first thing. I know that Tim can definitely kind of go over your first question a little bit more, because a lot of what you're talking about is the benefits cliff, which is a huge issue that we try to advocate for, which is essentially once a person gets a raise or starts to find themselves in a better position, they don't necessarily qualify for all the same programs that they normally did before, even if they are only making about $2 or so more an hour than they normally are. And so, like you said, at the end of the month, they're really scraping by. So I'll let Tim go into that a little bit more.
Cool. Thank you, Hallie. And just as a note, I dropped a link in the chat to the USDA FNS, which they also do some great work on recipes, some other things, and that has become much more of a focus for them. And so, along with Feeding America and some of the other organizations that can do so, but the FNS, in fact, I think they do a monthly newsletter now that gives ideas and some of that. So definitely look under it's USDA FNS is Food and Nutrition Services, and that sub-agency that resources there as well. And I'd marked down a number of questions and issues, so I hope my note taking proves worthy here. If we miss anything, please let us know. But the first thing was, on some of the activities or ways to do outreach, yeah, definitely on distributions. I can tell you that there are groups that do deliveries that are always looking for drivers and others like that. So it is another way to get people involved, but that is also a way to help do some stuff. Additional events or tying into existing events. There are, Arts in the Alley is a local yearly event. We usually have a booth at that, need volunteers for that, and it helps community awareness. And so looking at some of the events that can be tied into manning a booth or something like that, doing the drivers or new locations. 2 years ago, I helped with a special produce distribution at the local YMCA in an economically distressed area of Columbus. And it was amazing the response we got off of that, and it was brought together by some neighborhood groups. So trying to find some of the new locations, fundraisers, clothing drives, food drives, all of those are always appreciated. And I can tell you, we do get a good amount of donated food. We get non-food that is also donated that we get out to folks. And especially on the fundraising, we are through the governmental programs. Prior to the pandemic, we were able to purchase food through the federal government programs at 10 cents to the dollar. So the fundraising, the funds that we did, 75% of our operating budget traditionally is through development, through fundraising, and that's money that we can use to buy at bulk through those programs. So fundraisers are definitely always appreciated. And again, reach out to other groups that may be doing something. I know right now I've got a couple groups that I'm following up with to see where we can tie together on some of our efforts. One of them is geared toward helping the homeless population. The other one has a different distribution system, but there may be some overlap. So there are a lot of ways within the community, whether it's through the volunteer or tying it with other groups or finding a way to support the efforts that are out there. So that was the first one I had. On trying to get in with the food bank and through their agreement, I will say we are governed. We have 680 agency partners, which basically pantries, soup kitchens, whatever the distribution is. As a food bank, we cover 20 counties in Ohio, including some that are 2 hours away. Those 680 partners that we work with are governed by a contractual relationship. And that we have had instances that Pantries and others do not want to sign the agreement, and we cannot operate without that agreement because of regulatory oversight in some of the other areas, because it is to set it up that we do have our own issues. So I'm not sure what the particular issues were that came up on that, but that is something that it is a contractual relationship, and it has to abide by that. And that is largely for the safety issues. So we can come back to that. Let's see. The thing that I had is a third issue that was brought up on the national list. Yeah, I have some actionable items off of that because there are a lot of issues going. And I think the biggest one that has come out lately is up until the past week, it looked like the waivers for school feeding and summer programs for children, that was going to be extended into the 22-23 school year. And that has now blown up in smoke because of opposition in the U.S. Senate. And that is going to be a big issue because it got a lot more food to children, especially through the summer programs, and it potentially is going to dry up those opportunities. So we can talk a little bit more about potential actionable items on that. And let's see, Hallie hit about the benefits cliff, and that is really one of the things that we continually talk about. And I will say that I was on a national committee call yesterday that One of the things that is being pushed is a White House conference on nutrition and hunger. And we really want to get that because that would be an opportunity to talk about what two of the biggest issues are. One is somebody's at 130% of the poverty level and they can qualify for a program. They get a $2 raise and it kicks them off of that assistance. Well, then you go back to what they lose in that assistance, that $2 hourly wage increase that they got, it's costing them $4. And that is one of the problems, and that's the benefit cliff. That is, people do rise up, they lose the benefits, and there is no scalability on those types of benefits and elsewhere. So how do we address that people are not punished for getting a raise or to continue to have a livable life? And let's see, is there anything that I missed in general?
Well, I want to say to Camilla, I would love to put you in contact with the Greater Cleveland Food Bank. I know there might be other agencies that are working that don't have that requirement in terms of that, like, there are some agencies that don't have to have that sort of, that they serve other people that aren't on that specific. There are some organizations. So I'm gonna, after I can put an email in so you can talk with them because they know the Cleveland area. So I would really like to give you some resources, and they know agency partners that might be able to help them.
I see a couple of hands up. I see Jeff Brieger and then Richard and then Phil.
Yeah, you just passed through it fairly quickly, but I think it is going to be an absolutely major issue. I just have some experience working in a food pantry, and I noted carefully the transportation requirements for people who are utilizing this particular pantry in Pontiac, Michigan. I just filled my gas tank, $50. $50. It's pretty obvious that a new initiative is going to have to take place, how to connect the providers, which are the pantries and related brands, with the customers and clients. And I'd like to hear your ideas because they have to be produced pretty quickly. And that's not a matter of existing programs, but it has to be new initiative, expansion.
Mm-hmm.
Yeah.
Yeah. And actually, that is a great point in that, when you look at the sudden increase in gas and the impact that has on that, as what we were talking about here are the social determinants, and that is one right there. And so one of the things that we have done is partnered closely with some of the other community agencies, in particular on the south side of Columbus. One of our agency partners takes a very holistic approach, community for all development, in doing some job training, but also in doing outreach, in assisting people in signing up, whether it is for SNAP benefits or Medicaid or whatever, that they do have outreach. And we also have that through the food bank, that we have an outreach team. And with that, we tie into some of the other relief providers. Unfortunately, I don't have an end-all solution for you, because I can tell you that is one of the issues that we've been talking about. In fact, referencing again the call that I was on yesterday, one of the things we've talked about is the system is too fragmented. And a big part of the reason the system is fragmented, food insecurity is USDA, and that filters down to the state. Medicaid is Health and Human Services, and then CMS, Center for Medicaid and Medicare. Then you have housing and urban development. So you have each of these large federal agencies that has their piece of the pie, and that oversight and delivery of services and funding filters down to the state and the local level. And so the question we were talking about yesterday is, how do we tear down those silos and have it come through just once so that it addresses all of those issues. And you're seeing that done innovatively through organizations like ours and others, and working together on it. And what we're trying to do is push up and get the government to do the same. But bluntly, getting the government to change is pushing the boulder up the hill. You know, and I'm not, it is something that we are working on, is tying those services together, you know, both on the front line, but also on an advocacy side. And we really do have hope that if we can get this White House conference pulled off, that will bring light to a lot of this. And
Richard Tucker. Still muted.
Thanks to you three for a very solid and useful nuts and bolts discussion here. It has taken me back 6 months to when we came out of last July's yearly meeting, wondering how to keep going in communication among our various monthly meetings, how to keep going in sustaining and probing further the connection between our peace, nonviolence, and social justice programs and our earth care programs. And so we've been doing, taking turns on this. What strikes me about today's session in one way is that it's beautifully one side of the coin of food and agriculture. So I'd like to issue an invitation, because within Ann Arbor monthly meeting, we have a discussion going on, some of us, about how to gain traction for the range of issues of sustainable or regenerative agriculture. And that would be the other half of this discussion. And so I want to invite anybody who has experience in your own monthly meetings or individual thoughts about traction, not just discussing the vast story, past and present, but what we are doing or can be doing with the Ohio legislature or in our local communities to foster all of this. I'd love to hear more creative ideas on this for the months ahead. And in that regard, I have a curiosity for those of you in Ohio, where I spent 4 years a long time ago. I'm aware that there are various campuses, college campuses in Ohio that have food programs, both studies and hands-on, that are often very creative. One of them that I know something about, I have a buddy who is one of the creators of it, is the Mansfield campus of Ohio State. And I'm wondering whether monthly meetings in Ohio, well, the question is the same for Michigan or Western Pennsylvania, but particularly Ohio, whether there are monthly meetings who are in contact with the terrific creative energy that the students and the faculties have in some of these campuses. It's obviously, in a way, a generation question, building enthusiastic bridges between elderly Quakers and younger student hands-on people. I'd love to know more about what those connections may be or could be.
You want to lead off, Hallie, or?
Sure. Yeah, absolutely. So us in Columbus, you know, we're very fortunate that we have the main Ohio University campus, you know, in our backyard. And so we have definitely made use of it as a great partnership of not only educational opportunities for students, but also educational opportunities for us. We've utilized different departments within OSU to help generate answers to different questions that we have in terms of our internal functions. We are currently working with a partnership with the OSU Medical Center of trying to get some young professional doctors out to volunteer and kind of make the connection between food is health. And so that's a great partnership that we're working on. We've had OSU business students kind of work on different models of engagement with us. They're great volunteer resources for us as well. All of the campus organizations, especially sororities and fraternities and different other academic organizations, have requirements for community service hours. So that's a great opportunity for us. We also have a great partnership with Columbus State. We have as one of our assets a program called Mid-Ohio Markets, and it's a way for us to kind of destigmatize what it means to go to a food pantry, of kind of creating a more shopper's experience within a food pantry system where there's more choice, and people don't have to feel like they are going and receiving help, and kind of reducing the stigma of that. And what's great about the Mid-Ohio Market that's at Columbus State is that a lot of the volunteers there, it's kind of created as a work-study program. So you have a lot of student workers that are coming there and working at the pantry and getting either credit hours for it or some kind of community service hours. And where Columbus State is located, it's located in a relatively low-income area on the other side of our downtown area, and so there's a large homeless population down there, and so it's kind of connecting students to various different demographics and different types of people that would come in and utilize the pantry, and so it's a great learning experience for those students as well. But yeah, those are the two main partnerships we have with college students that are really great. And I've actually been to that Mansfield extension office before. I have relatives that live in that area, so I've gone there before, but they have a great system that's over there. So.
And Hallie, I would add on to that too, that we have an urban farm in the Hilltop in Columbus, which is an economically distressed area that we are tying into the community, with the self-production, but we have worked closely with local government on that, the USDA, but also with Ohio State University. It's one of the top agricultural colleges in the world, so it makes sense. So we have that tie. One of the things we're looking at is the Ohio Farm Bureau and some of the other statewide organizations, how we can work with them to take what we're doing in Columbus, how can we take that out to the other 20 counties? So what you talked about, Richard, is right on line with what we're doing. I would say we're early steps of it.
Phil Volk, do you still have a comment or question?
Yeah, I have several. Towards Richard Tucker's statement, we're close to Eastern Michigan, Eastern College, and U of M, and we talk to the fraternities and sororities to do their community service with us. And that helps out to be an intergenerational situation. Now, they were talking about recipes. We have talked to several chefs in the area, and they come out and actually teach a class on how to use vegetables. It becomes a very wonderful bonding time that we have. We also have 2 volunteer nurses that come in and talk about nutrition for the families. And they also volunteer when we get enough signed up for it on pregnancy, natal care. So we try to provide college or classes to help them move along. We have a small food pantry. We only do 200 people a day. So we try to do the best we can. But I find that the nutritional classes really alert a lot of people what is good for them.
Mm-hmm. Yeah, those are great points. And it's something I will also highlight. We have one of our assets is the Mid-Ohio Kitchen. that is located in a community center on the south side of Columbus in another economically distressed area. And part of its focus is on nutrition, spreading that. We previously tried that, coming back and retooling some stuff, but getting not only prepared meals, community meals, but the educational aspect of it. Because what we find, a lot of the food that we get in at the food bank is what is available. You know, what we always talk about, because this was legitimate, we had a large box of rutabagas come in. Who knows how to cook a rutabaga? I don't. And so, yeah, we've got a few, but that is part of what we're doing is, okay, here's what you can do, because it is actually a very nutritional food. Here's how to utilize it. The other thing it gets into, the ethnic communities, that you do have people coming from different areas of life and certain, you know, what they grew up on or what they need. And then you have the medically tailored diets. And so it is getting a lot of this teaching out there. This is how you can eat healthy. These are foods that you can use, and also tailoring the food to whatever the particular need is. And that's something that's we're focusing on, and also a lot elsewhere. It's a good point.
I just have one more thing to add for recipes because it just came off the top of my head. So the Second Harvest Food Bank of North Central Ohio, their nutrition and outreach director, Polly Leland, who was actually an AmeriCorps that served with me as well, their website and Instagram page did a great job in making some short videos of utilizing produce. And she made a really good stuff like squash that was I've actually made before. But if you're looking for, you know, relatively recent documentation of recipes like that, Polly has done a really great job, and that's another link that I can just find real quick and put in the chat for you guys before we end today.
And Bill, we are good to keep going if you want to extend it. We're not on a particular timeline, so.
Are there other questions from the group or commentary? Oh, I see Barbara. Go ahead, Barbara.
I was just curious if you're aware of any specific initiatives or collaboratives being done around addressing like the mental health trauma aspect of dealing with poverty and hunger and poor nutrition. Like, is there anything, any organizations or partnerships that are active in looking at that or working with that?
The Community Shelter Board in Columbus is really the lead organization on the homeless population, and with that, tying in some of the issues on that. It has been a focal point largely based off of the experience of the pandemic, which, you know, during the pandemic, you could not have congregate meal sites because of spread. And so what you saw was the homeless population and others taking, you know, vacant motel space or else to get housing, to get it, and to be able to get folks some of the services. And based off of some of that experience, I think you're going to see, at least in Columbus, and I would imagine this is going to be throughout the country, some of the learnings from the pandemic are being applied. It's not immediate, but, you know, within Columbus, I would say two of the lead organizations, Community Shelter Board, as well as the YWCA downtown. And you do have some offshoots off of that. And it's trying to address getting folks there, the living space, tying in the consistent food to it. How do you tie those together? And I will say, unfortunately, on the mental health aspect, that is still lagging. That is probably the greatest broken system in the U.S. and that's being tied in individually, but not necessarily on a broader.
I wondered about in Michigan, in Detroit area where I live, there's been a lot of focus on farmers markets and expanding the access to produce and farmers market products. Is that a point of competition, or is there collaboration between food banks and farmers markets? Do farmers markets serve as a point of distribution? What are there any overlaps in this work? Collaboration.
We do support produce markets, farmers markets, and actually with our urban farm in the Hilltop, there's a Westgate Farmers Market that is struggling, that serves that neighborhood. We will be working with them to try to provide food. So absolutely collaboration in getting the food to them and trying to get things set up, and also not only with the farmers market, but also doing additional produce given handouts, and those often tie in with the participants. So it is one of the more successful collaborations, I would say. Hallie, I don't know if you.
Yeah, that would definitely be one, absolutely. And correct me if I'm wrong, Tim, but the expansion of the Thrifty Food Plan also included the ability for individuals to utilize farmers markets as an opportunity to purchase food at reduced costs. So that's another option as well. I know particularly for our Mid-Ohio farm, we're located in Grove City, technically within Columbus, and our Mid-Ohio farm director, our project manager over there, is active with their chamber and has been able to make connections with local farmers that go to that farmers market, that if they have any type of surplus, that they're able to donate it to the food bank as well. So that's another option that some food banks find themselves, is that connections with farmers who can't sell at farmers markets will donate to or sell at a reduced cost to food banks.
And you do get, certain programs, the double, I forget what, double your dollar, double buck programs that individuals who are on SNAP can go to the farmers market and get double the value of their SNAP benefits. And our outreach team and others work on that. So there are programs to make, some of the assistant programs go even further. And it's something we and others are tied into with the farmers market. I know the one I go to in Columbus, Clintonville Farmers Market once a month during the summer, they do that double benefit. So
it's called Produce Perk in Ohio, but there are other states that do it, and it's very helpful, encouraging and encouraging more nutritionally dense food, as well as stretching the dollar through the end of the month. If you're a week out and you don't have food at the end of the week, if you have more vegetables, that's good for both of the ends of the budget. In terms of specific actions that we're talking about, there's the obviously getting and working, like doing a volunteer shift. That's an actionable step that we can all take if you want. Like, it doesn't always have to be a donation specific. There are many actionable steps that we all can do. And one thing that I was really excited about Hallie and Tim talking about was, like, there are specific legislations going on that are really important to advocate and tell your representatives that we started to speak about. And some of that is the Farm Bill, which will determine how much money is put to all the kids' meals programs. And if we talk to or educate others that these things are going on, like that, the dollar going to that is going to actually give those meals to people. So knowing what legislation's up and talking to different people and just being like, wow, this is a thing going on, and this will allow us to, like, have other people put that money towards getting those meals out to people. So not only volunteering, but telling people about legislation and getting on the phones and the emails. So,
well, I'd like to thank our presenters today for a very informative session. Lake Erie Yearly Meeting really appreciates your time, and we also appreciate North Columbus for making all these great connections. And I'm going to go ahead and stop the recording. I just want to thank you very much for your presentation and for your support.